Hello and welcome. I'm Ruby Barlow and you are watching The World Report. Let's take a look at some of our top headlines from this hour. US Secretary of State Marco Rubio has said that the United States has so far not received a response from Iran, but has said it should come soon as discussions on negotiations continue. Iran has said they will relay their response to Pakistan, the current mediator. US President Trump says ceasefire holds after a clash in the Strait of Hormuz, with the Iranian and American forces exchanging fire. Iran has said the US broke this ceasefire. The United Arab Emirates has managed to slip at least 4 oil tankers through the Strait of Hormuz, according to reports and industry data. The ships turned off their tracking data. 2 out of the 4 are headed towards South Korea. Russia and Ukraine have accused each other of breaking the 2-day truce Russia set out unilaterally for May 8th and 9th to mark their celebration of the national holiday Victory Day. Ukraine argued that the ceasefire should have begun 2 days earlier and be indefinite. A hostage situation at a bank in the town of Sinzig in Western Germany has now finished with no one hurt after police freed 2. The suspects have escaped by means unknown, with police now investigating. The UK Prime Minister has vowed to continue in office after the British Labour Party received poor results in local elections yesterday. Results are showing strong showings for the Green Party and the Reform Party, signalling a possible shift towards multi-party politics in the UK. A day after meeting with US Secretary of State Marco Rubio, Pope Leo has said he has asked God to inspire world leaders to calm global tensions and reduce hatred. Pope Leo has recently drawn comments from Donald Trump, who said he was endangering Catholics. And finally, the renowned naturalist Sir David Attenborough has celebrated his 100th birthday with tributes flowing in from around the world. He has been presenting nature programs for more than 70 years. Global health authorities are on high alert tonight after a Hantavirus outbreak was confirmed aboard the Dutch cruise ship MV Hondius. At least 8 people are now infected and 3 passengers have died, including a Dutch couple and a German national, since the ship departed Argentina. The specific strain identified is the Andes virus, the only hantavirus known to spread between humans. Authorities are now scrambling to trace at least 30 passengers who disembarked at the remote South Atlantic island of St. Helena. According to several critical cases, have been air evacuated to hospitals across Europe. The ship, carrying nearly 150 passengers and crew from 23 nations, is currently en route to Spain's Canary Islands. The CDC, the Centre for Disease Control out of the United States, has classified the outbreak as a Level 3 emergency. However, the World Health Organization is stressing the risk to the general public remains low, and this is not a repeat of COVID-19. Let's listen in to what the Spanish Secretary of State has had to say.
A través del Sistema Europeo de Alerta Temprana y Respuesta Rápida, el Early Warning and Response System, España ha tenido conocimiento de que 2 de esas personas tenían como destino final nuestro país en ese viaje. Tras contactar con una de ellas, ha referido síntomas compatibles, principalmente síntomas relacionados con tos, bienestar general, mientras se encontraba en su domicilio familiar en Alicante. Lo que se va a proceder a hacer con ella es lo que he explicado antes, que se va a hacer con cualquier caso sospechoso, que sería esto, un contacto que tiene síntomas compatibles. Eso sería un caso sospechoso. Es trasladada al hospital por parte de la Consejería de Sanidad de la Comunidad Valenciana. Allí se le mete en una habitación de aislamiento con presión negativa y con todas las precauciones que sean necesarias, y se le toma una muestra de PCR que será enviada al Centro Nacional de Microbiología en Majadahonda, y esperamos tener en las primeras 24 horas los resultados a ese respecto.
So that was just the Spanish Secretary of State commenting on this latest hantavirus outbreak. It's now been a couple of days that we've heard about this new virus outbreak on this cruise ship that was originally a mission for some tourists to see some areas of Antarctica. And then this hantavirus outbreak was discovered when the ship was off the coast of Cape Verde in Africa. Now, of course, these health organisations have urged the general public not to worry, that this is not another repeat of a COVID-19 pandemic, that this is a different category, that it is definitely not a pandemic. However, this death rate for this disease is around 40%, which is definitely worrying. Now, this ship was carrying nearly 150 passengers and crew from 23 nations. Of course, quite a variety of nations there. Now, there's been tracing done across the globe to try and see where these passengers may have ended up. Now, they some of these countries include Canada, Denmark, Germany, the Netherlands, New Zealand, Switzerland, Sweden, Singapore, St. Kitts and Nevis, Turkey, the United Kingdom and the United States. So of course a very wide variety of countries all around the world there in which some of those passengers may have disembarked before officials knew of this outbreak. The UK health authorities have identified a new suspected case of hantavirus linked to this cruise ship outbreak. Now, this was a British man on the remote South Atlantic island of Tristan da Cunha. We're now joined by Dr. Akash Jain, who's a chest physician, joining us now from New Delhi. Thank you very much for joining us tonight on the program, Dr. Jain. Very much thank you for your time and for your opinion to discuss this latest developing story with us. Now, authorities have said that this is not a repeat of COVID-19. How worried should we be about this hantavirus outbreak on this cruise ship, given the fact that it has affected so many passengers who are now disembarked to their home countries?
Yeah, it is not. These are viruses which are spread by aerosols and by air droplets, which is similar to COVID, but it is not as infectious as what the COVID viruses. So these are dangerous, but not quite communicable. So the group has to be in close contact with each other. So it is different in that respect with COVID. Another thing is it is different from COVID. It is mainly spread by the rodent droppings, urine, saliva, and droppings of rodents. So there is no human-to-human contact like in COVID. So most of the cases occur where there are large number of rodents available. So we are good in that respect, that it is not as infectious and the spread is different.
Mm-hmm. There's also been some talk about ivermectin. Of course, this does bring another throwback to the COVID era. How much can we be concerned about disinformation at this time, especially given it had a very large role to play during the COVID pandemic era as well?
No, as I've told you, there's nothing to worry about. This is not as communicable as the COVID. Second, COVID happens by human-to-human spread. So one person is infected and it can spread to other persons. But normally these sort of infections, hantavirus infections, are spread by rodents. So when, like as you have said, in a cruise, a lot of persons are supposed to be had this hantavirus. So when they are exposed to rodent exposures, droppings, so it is spread in that context. So in normal settings where you are living, so the chances of spread are quite less. So we should not be worried much about that.
Mm-hmm. What about the role that misinformation has to play during situations like this? Of course, we saw this happen during the COVID pandemic, but could we be seeing the release of false medical information, perhaps sensationalism regarding this hantavirus?
Yeah, that is the problem, that I think media has an important role in that. Media has to take care of this misinformation that it is not this thing. Social medias are definitely reason to spread this misinformation, but we have to spread accurate information through your channels.
This specific strain, of course, it is spread to human contact, but it does have a longer incubation period, about 6 weeks. How long could we realistically see this outbreak play out, especially if some people may only become symptomatic in perhaps 6 weeks' time?
Yeah, it spreads. It's a long incubation period. But another thing is what you have said is about human to human contact. The WHO is still contemplating. They have not confirmed that there it has been a human to human contact. There are some. They are still contemplating and researching about this thing. Still, the most common cause of hantavirus infections are, as I've said, that is through rodent exposures. And another thing is, it is very dangerous. A few cases do develop hantavirus pulmonary syndrome that it infects lungs, and it is very the mortality is very high, almost 3 to 4 persons in every 10 persons. If we get into that stage, it can cause death. So, in any case, we have to be very cautious. The prevention is just like any other aerosol related cases, which we have to avoid close contact, proper isolation, and these things do help in preventing and spreading further uh, this thing disease.
Of course, we live in a very globalized world now, Dr. Jain. The CEO of the Infectious Diseases Society of America has said the United States is not prepared to handle a possible hantavirus outbreak after cuts to the Centre for Disease Control and Prevention. Now, how important are public health physicians in situations like these for the outbreak of possible pandemics, but also for foreseeing how to manage the outbreak of diseases like this?
Yes, first thing we have to be aware of this disease. The public, we have to make proper awareness campaigns and in the areas where a few cases has already been established, we have to be more careful in those areas. Otherwise, also because as you said, because it's a global problem now. Any disease, any infectious disease can spread very quickly from one side of the globe to another. So we have to, the only thing we have to do is early identification and detection of this disease. Only then we can prevent further communication and spread of disease. So there is no treatment right now for this particular problem. The only thing we should it should matter is that we should uh, identify and diagnose as early as possible. And the problem is this sort of infection spreads just like any other flus, like COVID. Any other viral infection. The symptoms are early symptoms are same, like fever, body pain, headache. Only in some cases it spreads very quickly. So early identification by PCR and by diagnostic means is the way. We have to be a bit aware of about this problem. Only then we can identify.
Dr. Jain, how exactly does hantavirus affect the body, and what mechanisms does it play against in the human body?
It's most of the cases of hantavirus infection spread. The symptoms are just like a normal viral headache, body pain, fever, and these cases subside on its own. But a few cases do aggravate. The persons who have low immunity or having other comorbid conditions, they can go into, as I've said, hantavirus pulmonary syndrome, where lungs are involved. Patient develops pneumonias, goes on ventilator. In that cases, the mortality is very high. Uh, Even in very good centers where ECMO support is available, 4 out of 10 patients can die because of this problem. In another one of the other varieties where the renal and kidney gets shut down because of this infection. Though these sort of cases are less, but out of every 100 patients, a few patients, 4 or 5 patients can uh, have this sort of exacerbations. So it is a dangerous infection, and most of the cases get settled on its own, but few cases can have aggravated and can land into the hospital. Treatment, there is no treatment. We have to give supportive treatment, only high fluid hydration, and in some cases where it seems that patient is going into that pneumonia and shock, early hospitalization is the only treatment.
I've seen reports, Dr. Jain, that researchers are looking into developing a vaccine for this hantavirus. How long would the possible development of a vaccine take, given the advances that we have made during the COVID pandemic? And at what timeline could we possibly see for a hantavirus vaccine if scientists were indeed successful?
See, vaccine is a long process. Normal, it takes years of development and then years of research and trials to have proper vaccine. And the effect of vaccine we have to see on persons. There are multiple trials. So any vaccine or any drug which we have to develop, it takes years. In COVID era, definitely it was very rapidly developed, but we still see the side effects of those vaccines, which we actually started very early, before proper trials. So until unless it is any epidemic happens, we have to go it slow, and vaccines normally takes years. It normally takes 4 to 5 years to develop.
Dr. Jain, thank you so much for joining us today for this discussion and sharing some of your expertise with us. We now move to South America. Amazon's massive data center project in Chile is moving ahead after residents and environmental groups lost a legal challenge against the development. The project, which was planned by Amazon Web Services near Santiago, had faced opposition over fears that a future high voltage power line could damage green hillsides and local communities near the Andes Mountains. Chilean environmental authorities ruled that the data center can proceed, saying any future power infrastructure would be reviewed separately. Amazon Web Services has said the facility will use technologies designed to minimize energy and water consumption. The company also plans to invest over $4 billion in Chile over the next 15 years. The development is part of a global expansion in data centers driven by rising demand for cloud computing and artificial intelligence. Experts say Chile is becoming a major hub for the industry thanks to strong digital connectivity and government support, but warn that environmental protection must remain a priority as tech investment grows. We're now joined by Vibhuti Rai, who's a geologist joining us now from Lucknow. Vibhuti, thank you so much for joining us for this discussion. Now, what could be the possible environmental impacts of a data center of this size in Chile? Should these local residents be concerned now that their lawsuit has lost?
Absolutely correct. Actually, the data centers across the world are mushrooming like anything, especially in the light of the AI. And these servers and these chips, they are very, very hot in the sense that they require a lot of cooling system, for which fresh water is taken into consideration, and continuously these are being chilled up so that there is no breakage in the data transmission. Now, Chile being one of the developing countries, and the population there requires the fresh water, which is not in plenty out there. Such a huge data center out there is going to create a lot of issues related to the groundwater, which is merely the purest form of water available. And the same would be used by people as well as by these large data center computers. I think the government there should also look how they are going to provide excessive water, because once the data center are established, it's going to create a huge difference, because continuously such fresh water would be required. And you can't just use the very hot water coming out of these data centers for anything. So in that sense, I think the technology which is developing these high-end chips should also develop some technologies where cooling system is being done using similar chip type of things. I know for certain there are some small refrigerators which are just using a chip, and they are having quite a cool impact. So I think along with that, such chip system may be one of the answers to avoid the drawing of excessive fresh water, either from ponds or lakes or from groundwater. So that is, I think, one of the solutions they must look into. And this should be done right from the very beginning, instead of just developing a huge data center and then nothing can be done. So this is going to be a big environmental problem in the years to come. And I think we need to work it out in what manner such cooling systems are going to be executed. Most of the governments, they are not much aware about the technologies, and therefore the companies which are developing the IT sector, especially the AI, should also develop the cooling systems where minimal water is required.
Mm-hmm.
Yeah.
Mr. Rai, there's also, of course, a major resource of critical minerals in Chile, as you would well know as a geologist. Why would the Chilean government be heading towards this direction for data center development economically when they have such valuable natural resources at home?
Yeah, that's a very interesting question, because Chile is one of those countries which has huge mineral resources. It has rare earth elements, also elements which are required for technologies for batteries, such as lead, zinc, etc. And along with that, lithium, which is now coming in big form, is being used in batteries. So they have a huge resource, but mineral resource exploitation requires a huge infrastructure. And then utilizing these minerals, or for business purposes, exchanging or selling the minerals to other countries where they are required, is a long process. Here, what I can understand, these data centers, the companies which are sponsoring these establishment of data centers would be paying a huge amount of money to the government of Chile. And that must be one of the reasons that they have given priority to the establishment of the data centers instead of working out on the mineral resources, for which they have plenty of it. One more thing I would like to add, that most of these companies which are developing these data centers belong to US. And why on earth US is not providing these facilities for establishment of data centers? They have a huge land mass and they have a huge resources to develop it, I think, and with a very gentle population distribution across the country. I think the government there should also think about it. I know for certain that in Middle East, such data centers were established and were in the process of installation, and mainly in the desert region, which are already devoid of fresh water, but some water purification plant near the Hormuz area were developed, and such distribution of such huge networks, data centers are required. I mean, that is the need of the world, because everything that we do converts into data, and somewhere we leave a data print, or as we call it, a kind of a huge data set for each individual across the world, which are stored in data centers. And basically these data centers, they are keeping the data, and they are charging the customers, making huge amount of money. So I think that is one of the major issues where the government of Chile should look into, and should ask because citizens have been protesting there continuously, and but the government is not listening to it. Certainly, I think government should look into the technical part of it and see how water resources are being minimized in utilization for the data centers, for which they must also have a side plan of
Indeed.
generating more water resources, freshwater resources,
Yes.
for the development of these data centers.
Exactly. Vibhuti Rai, thank you very much for joining us today for this discussion. That's all that we have time for. Keep watching NewsX World for more news updates coming to you from around the world.